Lady Charmaine, and my guest today is one of the stars of Lifetime's newest hit show, and she's here today to talk about the second season of Atlanta Plastic. Help me welcome Dr. Aisha McKnight Barron back to the show. Welcome, young lady.
Thank you so much. Thanks for having me.
Oh, it's a pleasure having you on the show again, and I want to say congratulations on your second season.
Yes, I'm very excited, Glad that we were picked up for many more.
I know, because see, when we spoke before, you were saying how you were approached by several other production companies about doing a reality show, but this one was a good fit for you. So tell me about your taping experience for the first season.
Right. So the experience with the first season and the reason why I chose the show was because it really just wanted to showcase my professional life. There, I didn't really have to deal with the drama of someone trying to come in my house, be intrusive to my personal life. And, I just didn't really want that. I didn't really want to portray anything like that. So I think really just focusing on my professional skill, and really sharing that with the rest of the world was really awesome. And I'm really happy with the product of the first season. And I think viewers will definitely be happy with what season 2 has in store.
Yeah, because I know since airing the first season, has your office been getting more phone calls? And if so, how are you handling the influx of new business, or do you just refer them to colleagues in the business?
Well, we're pretty much able to handle all the calls that come in. Around that time, it was kind of crazy. I think the server on our website got shut down temporarily after the first episode because of the influx of inquiries and everything. But, we hired extra receptionists and, we really try to get back to people in a timely fashion. So, some people are just kind of curious and they ask for just price listing and things like that. So we tried to update our website to make sure that we could give ample information for people who are just calling for information. Because frankly, you get a lot of people who are kind of like just tire kickers who just kind of want to see what, things are about, and so we kind of have to filter out those patients to the real patients who really want to make appointments and schedule surgery. So, by providing as much information as we can on our websites and through, our girls that answer the phone, then, hopefully we're serving the public in that.
So I know that right now you guys are doing cross shows because in this season, 2 of Lifetime stars from the dance show Bring It will be getting some new derrieres. Tell us about that episode.
Right. So I think on the first season, Dr. Crawford is actually operating on Mimi from the Bring It episode. And from what I recall, I think you did a tummy tuck, some liposuction, and a buttock augmentation. I actually operated on Tina, one of the other moms from Bring It, and you'll have to tune in to I think episode 3, which is what she's on. And I and has lost a ton of weight, and so had a lot of extra skin, things that were in places that she didn't plan on them ending up. And so, I basically kind of helped her with her mommy makeover.
Okay. Yeah, the call went out just a little bit, but I was able to catch what you were saying. Can you hear me okay?
I can.
Okay, good. Now, large derrieres today are like such big business. What is the safest way, to get a large tush?
Right. The safest way is to go and see, number one, a board-certified plastic surgeon who has experience in that area. Do not go to anybody's hotel room, back alley, medical spa in order to have that done, because really you could pay for that with your life.
Right.
I think, just researching your surgeon. The safest way in which we perform it is with the least amount of is fat grafting, and that's basically using liposuction to take fat from another area of the body where it's unwanted, and harvesting that fat and then injecting it with syringes into the gluteal region to plump up areas, to fill out areas, and create a more pleasing contour to the buttocks.
Okay, so you're using basically your own body fat, so that's the safest way. Okay.
Yeah, I mean, there's other ways in which to use gluteal implants, which are actual silicone implants, but they do have a higher risk of complications. So if you have the fat to use, then that's the safest way. Patients who don't have any fat or a little amount that wouldn't cause a significant difference after fat grafting, then we can, we sort of consider a gluteal implant, but they have a higher range of complications such as infection, misplacement, and everything like that. So I think if you can use your own fat, then that's the safest way.
Well, I have quite a bit of that in the tummy area, so I think I'll be okay there, and I'll just transfer that.
Yeah, see, it's all recycling.
Right. Well, you don't
Surgeon
want it.
the plastic surgeon is the recycler. We use tissue and parts and skin from all areas on the body to reconstruct things. So, one surgeon's trash is a plastic surgeon's treasure.
Wow. That's a good way to put it. So is it easy? Because you know how a lot of women were getting extra large derrieres, right? They were just huge. Even K. Michelle recently got a tush reduction. How easy is it to get a reduction? And what do you do with that, the excess skin that has been stretched out?
Yeah, I actually haven't done many reductions, just because I typically do not do, significantly large gluteal augmentation.
Mm-hmm.
I like to give my patients natural but noticeable results.
Mm-hmm.
And so most patients, they would, if they had a gluteal augmentation that was too large, then potentially you'd start with liposuction to kind of debulk that area and see how the skin contracts. It may take several procedures, and if the patient was left with excess skin, then sometimes cutting that skin out so that it's inconspicuous sort of within that gluteal fold or crease might be beneficial. But it just really all depends on the deformity. I kind of, I tell patients when they come in for a consultation that there's trends, just like there are trends or fads within pop culture, there are trends and fads within plastic surgery. And so what is popular today may not be as popular tomorrow. Right. And so you're going to have to be willing to live with your results, because these are life-changing decisions and they're permanent for the most part. So, I tell people to really think about, what they want, whether it's, increasing the size of their buttocks, or if it's the size of implants that they desire, decrease the chance that a patient is going to come back for revisions or be unhappy with their final results. So counseling, doing a really good informed consent up front will kind of decrease the chances of things like that happening.
So what is your most requested procedure?
My most requested procedure, I would guess, is the mommy makeover, which basically includes some sort of breast contouring surgery, in addition to a body contouring surgery. So a breast lift, breast augmentation, or a breast reduction paired with liposuction of the midsection or abdomen, or a tummy tuck. That's a lot of patients come in, they want to have multiple procedures done, because a lot of them think, if you're going under the knife one time, then you might as well kill as many birds with that one stone.
See, my husband, when I say that, he trips out when I say kill like 2 birds with 1 stone. He's never heard that, and I say it all the time. I think it's a female thing because I use that term all the time.
Yeah. No, absolutely. You want to be efficient with it, but within a safe range. You don't just tack on procedures just for the convenience of having one surgery. You definitely want to make sure that the patient is healthy enough in order to tolerate a longer surgery, potentially, and that they'll be able to recover from it. So within reason, we can, kill multiple birds with that one stone. But yeah, it's definitely, based on the patient's medical history and their resilience.
It's funny you say that because I have a 2-year-old. I have a 16, 13, and a 2-year-old. And
wow, congrats.
Thank you. I need to be on that table, girl, getting that mommy makeover. I'm going to tell you that right now. But I'm glad you mentioned about the person's health, because I wanted to know, what type of health screenings do patients have to go through or provide to make sure that they are safe on that operating table?
Right. So most of my patients that are above 50 that have medical issues such as high blood pressure, diabetes, things like that, pretty much all patients over 50 will have to get a pre-op physical, but that's within the past 3 to 4 months from their primary care physician, and that will include just the EKG, which is a heart analysis, basic labs, and then also potentially a chest x-ray, just to make sure that nothing's missed, and that who have any other medical issues that we kind of screen from our initial intake forms. Then I'll say, okay, you need to go to your primary care physician. If a woman is, over 40, she definitely has to have a mammogram on hand. So, I'm pretty much a stickler for pre-op clearance and making sure that patients are healthy enough to undergo surgery, because I think sometimes people get a little distracted with plastic surgery and they say, okay, this is what I want. I'm going to get it. I'm going to pay for it.
Mm-hmm.
You're only going to get it if it's safe enough to get it, and so I won't operate on anybody, and I have no problem canceling the surgery if a patient is not healthy enough by my standards.
And that was my next question. Have you ever warned anyone against surgery, against a procedure? And did you ever see them out and about because they went and got it done from someone else?
No, I haven't had an instance like that. I have had patients, I've warned them against, considering plastic surgery at the time. They've gone and gotten their health in order and have come back with adequate clearance. And then, whether or not they've lost weight and come down to a healthy BMI or something like that. I've had patients come back and then be suitable candidates for surgery. But no, I guess I don't really run into too many of my patients or former patients kind of out and about. Maybe I don't go out enough.
Because, everybody out in Atlanta, girl, especially if you're African American, they doing things out there.
Right.
So what else can we expect to see this season on the show?
So this season, you're going to see a lot of, at least for me, you're going to see a lot of body contouring, a lot of mommy makeovers, a lot of, heartfelt stories that I think that the viewers want to see. We have, at least for me, you're going to also see, a patient who was diagnosed with breast cancer, who is undergoing some breast reconstruction. That's a large part of my practice. And, I definitely think it's something that the public needs to see.
Wonderful. And Aisha, how do you say you don't get out much? So how do you spend your spare time when you're not working or filming?
Right. When I'm not working or filming, I definitely, I spend time with my family. I go out, do occasional shopping, although I do mainly online shopping, but, spend a lot of time with my family, my husband, my daughter, my sister and mother are here in Atlanta as well. And, I hang out with my friends as well. I don't really do I guess I'm not really super, super into the social scene, although that is changing a little bit. But, I get out every now and then, go out to movies, dinners, things like that. I'm not considered a socialite by any means, but, I value that time because I spend a lot of it in the operating room and at work. And so a lot of the time that I spend is really kind of low key, decompressing, also kind of trying to squeeze in some me time, getting a massage, relaxing, just because, being a surgeon can be high stress and it's physically taxing. So, doing all that liposuction back to back, and,
right.
Operating beds over.
Well, Aisha, I just want to say thank you again for coming on this show. And again, congratulations on the second season of Atlanta Plastic. And I want to remind the audience to make sure that you tune in Friday from 10/9 Central right there on Lifetime. Again, congratulations, Aisha.
All right. Thank you so much. I appreciate the opportunity. You guys can also follow me on Instagram and Twitter at breast_N Body Doc, and then also check out our websites and our Facebook pages.
So you said N at Body Doc. All right.
Yes, that's me. Breast and Body Doc.
Well, again, congratulations, and I wish you all the best.
All right. Thank you so much. I appreciate the opportunity.
You're welcome. Bye-bye.